Hey guys, Dr. Tripp from Cornerstone Physical Therapy coming to you today to talk to you a little bit about what is dry needling. So dry needling is something that physical therapists can use in adjunct with manual therapy, stretching, therapeutic exercise to release tight muscles and relieve pain. It also helps to improve function, muscle efficiency, and you can even see some reductions in peripheral symptoms such as numbness and tingling with dry needling. The biggest question we get in physical therapy is dry needling like acupuncture? And the answer is no, it's not. The only thing similar between dry needling and acupuncture is that it uses the same type of needle. Acupuncture works off of Chinese medicine and meridian planes in your body. There might be multiple needles in your body at one time, channeling different energy levels. There may be needles that are put into your hand that affect a different meridian in a different part of your body. Acupuncture has proved very helpful for some of our patients in physical therapy, and they do it in conjunction with dry needling. But I just want to tell you a little bit about what the difference is between dry needling and acupuncture. So if we take a look at this little needle, so they're all in their special little case. I've already opened it a little bit. When we pull this out, it's in a small tube to keep the needle clean and sterile. And then you're going to pull out this little tab, and the needle stays inside the little tab. So you can see how thin it is. What this does with dry needling is that when your therapist is palpating on your body and they find a trigger point or an area that's really tender, it feels like a knot under your muscle, we localize and hold that knot down, and then we use dry needling to get deeper into that area to release the tension in that muscle. Dry needling works specifically on taut bands in muscles. And what happens when you have a taut band in your muscle is there's decreased blood flow, decreased oxygen in that area of that knot. So if you grab your upper trap and you feel a big knot there and it's tender, that's a trigger point. That would be an area that would be dry needled if you were having shoulder pain or neck pain. And then in the surrounding areas, there's blood flow and oxygen. So you have this imbalance between a trigger point with decreased oxygen, decreased blood flow, increased pain receptors. There's also, if you go into a lot more detail, your spinal cord pathways that are relaying pain into the body, those are different and disrupted when there's trigger points in a certain area or muscle. So what we do is we find that taut band. We're asking the patient, does this feel like your pain? Is this spot more tender than this spot? We're trying to pin down that taut area. And then we take our needle and we kind of hold this little tube close to the skin. And then we take this part and we tap it into the skin. I'm not going to tap it into my own skin for demonstration purposes. But once the needle is in the skin, then we are going to take that needle and kind of go down into the trigger point and piston in that area into the muscle, trying to elicit a contraction or a twitch response. When the twitch response happens, you have oxygen and blood flow rush into that area, which is good, which is what you want, and a dispersion of pain receptors. The main complaint that you would receive from somebody after dry needling is soreness or tenderness in the area that was dry needled. 24 hours to 48 hours is typical. Some muscles, such as your calf muscle, can be sore up to 3 days after dry needling. What we look for after somebody has dry needling performed is their local sensitivity lessened? Do they have increased range of motion? Are they able to more efficiently fire and activate those muscle fibers in that area? The responses may not be immediate, but that's why as they come back to future physical therapy sessions, we kind of reassess. We may use dry needling again in not always the same muscle time and time after again, but surrounding muscles that could all be contributory to their pain. So once again, in a nutshell, dry needling is not the same as acupuncture. It uses the same type of needle, small monofilament needle. It's called dry needling because there's no medicine on the needle. And it's used to get deeper into a taut band or restricted area in a muscle to improve blood flow, improve oxygen, and overall muscle efficiency. If you have any other questions about dry needling, or it's something that you may be interested in or think it may help you, give us a call at 828-684-3611. We would be more than happy to talk to you about it, or give you some more information to read about dry needling to see if it would be appropriate for you. Thank you for spending some time with us today, and we'll talk to you soon.